Okay, hello everyone, my dear students, everybody in DAMS. I'm Dr. Anshul Divakar, and we are here with a very bright young gentleman, Abhinav Jain. He is a high achiever, as we all know him. He has secured an amazing rank of 204 in NEET 2022 and an amazing rank of 637 in INICET 2022. He is a fresher, which makes this rank even better. He has done his MBBS from Maharaja Agrasen Medical College, Agroha in Haryana, and he also belongs to Haryana, so he's in his in home state, and very happy, very chirpy guy. And today he'll be talking to us about his journey, about what he did, what he went through. So I welcome you, Abhinav.
Thank you so much, sir.
How are you feeling?
Thank you. I'm feeling great right now. It's like dream come true.
Yeah. So did you actually dream of a rank in top 200?
Yes, sir. I was dreaming it more good, but I'm satisfied with it right now.
Okay. So your aim was to get in even better than this. That is something which is
sir.
Very good. Very good. So you were confident that you're going to do good with this exam.
Yes, sir.
That is one of the very good things and I find these kind of aspirations and passion in internship batch a lot. Like people who are appearing with internship, they have this immense confidence in them. Very good. So tell me about your journey through MBBS. Let's first talk about what you did through your MBBS. How was your MBBS journey?
So I just started with my first year only studying. My favorite part was doing studying only. I just started doing studying whole night, whole day. Because I find fun in it. I find medical sciences very interesting. So from starting of the first year and till final year, I was like kitabi ki dal se. Okay. So I just love doing what I was doing at that time. So I just keep continuing doing that throughout my this, and some hobbies I keep continuing it as well.
What hobbies did you do apart from studying?
So I love dancing, and we have gone to many fests from the college side, and we have secured a very good rank and position there also.
Okay.
And I love playing badminton as well.
That is good. Two very good hobbies required in a medical student, because we get fat very easily. Right. So when did you really decide to start preparing for entrance exam? Like, you were a studious student, so you must have read all the standard textbooks, and every year you must have done what is required in MBBS, right? So for the prof exam, but when did you really start preparing for entrance?
So I'll say from internship year only, I started preparing for exactly for my NEET preparation. Actually, from second year, I started making notes. I was in the pre-foundation course, and I just joined the DAMS. Okay. So our first lecture was with Diksha Sikri ma'am.
Oh,
so she just made us fan. मतलब हम पैथो के फैन हो चुके थे कि पैथो ऐसे भी पढ़ी जा सकती है. तो उसके बाद फिर डैम्स वाज लाइक अब तो यहीं पढ़ना है. तो सेकेंड ईयर से हमने नोट्स बनाने शुरू करे, एंड फिर उसके बाद थर्ड ईयर हमने नोट्स बनाए, एंड फोर्थ ईयर फिर कोविड हो गया था सर. तो फिर उस दौरान सारा फिर से एक बार रिवाइज किया एंड ऑल, एंड व्हेन इट कम्स टू इंटर्नशिप तब मैंने थोड़े एमसीक्यूज करना शुरू किया. GT देना शुरू करा, टेस्ट देना शुरू करा. When I came to know real picture of entrance exam, उससे पहले I was not even sure कि कैसे होता है entrance में, क्योंकि मुझे subjective paper लिखना आता था उससे पहले. So I don't know how to approach objective questions at that time. So I was doing good in my university exams as well. I secured, I was topper in my university as well in second year, and third year I used to be topper of my batch. So I just keep doing this only.
Yeah, I didn't ask that because I presumed that since you are studying so much, so you must be a topper, which is a very, very good thing. And usually this is something that brings a lot of good things later on when we prepare for these exams. Your base, your foundation, if it is intact and it is solid, then building up on that becomes very, very easy. So yeah, I'm sure that must have helped. And what exactly was your strategy when you started really taking care? So I know that you were a pre-foundation, so you must have attended all the classes of second year, third year, final year in your foundation years. And you must have made notes of whatever was being taught. But when you started in internship, then what was your strategy? How did you strategize that, okay, I've got 12 months of internship and I'm sure 8 hours of internship every day. Along with that, how did you think I should approach this exam?
Sir, I'll be very honest in this case. I internship की starting में I didn't, मतलब मैं बिल्कुल अचानक नहीं लग गया पढ़ने. मैं बहुत धीरे धीरे build किया था मैंने उसको. So मतलब मुझे I'll say अक्टूबर तक मुझे पता नहीं था कि मैं कैसे पढ़ रहा हूँ. मतलब I was studying day night, but I don't know मैं कैसे पढ़ रहा हूँ. मैं हेवाय पढ़ रहा हूँ. मुझे नहीं पता कि मैं टारगेट होके पढ़ रहा हूँ, कैसे पढ़ रहा हूँ. मैं MCQs कर लेता था, कभी नहीं करता था. I was not disciplined at all with my MCQs and tests. So sometimes I study, sometimes I just go and chill with my friends as well. So I was not that serious, I'll say, because I'll simply say कि the second year जिससे जो पढ़ना शुरू किया था उसने बहुत help किया मेरा. मतलब I was not that studious from my internship starting, but at the last when I realized it's important and I have to focus on it, so I just give my 100% then. Like it's like October, November, I just started my 100%, giving MCQs, tests, CBTs, and everything. I just gave my 100% after that.
So do you believe that starting early makes a lot of difference in how you finally approach these exams in the last few months or few weeks of your preparation?
Yes, sir, I realized that it was very helpful. Like some questions were like that only कि जो मैंने second, third year में पढ़ा था वो मेरे को वहाँ पे strike कर रहा था. It's not like जो मैंने last में पढ़ा वो मुझे याद आ रहा है. जो मैंने अपनी throughout journey पढ़ा MBBS के मुझे वो सब याद आ रहा था वहाँ पे. So it was so helpful कि अगर मैंने इतनी जल्दी शुरू ना किया होता तो शायद मैं इतनी अच्छी रैंक स्कोर ना कर पाता.
Yes.
So second year से start करना was a great advantage.
Yeah, this is something even we insist. Most of the places, most of the students who come to meet, they are like, sir, why don't we start after internship or in internship? So it's like you always start early because this is a long course and there are 19 subjects and all of them are now asked in great detail. It's not like 10-15 years back when there was more of a repeat based pattern. So yes, starting early and building on those concepts does really help a lot. So that is very nice to hear. And how about the resources that you got at DAMS? We provide a myriad of things, right from your class test to subject-wise tests to GTs, CBTs, mocks. Then we give you DVTs. There are a lot of TNDs available. So how did you manage and utilize the material that was given to you by DAMS, the resource?
So सबसे पहले जब से सेकेंड ईयर में सैटेलाइट क्लासेस होती थी तो उसमें हम सिर्फ नोट्स बनाते थे. फिर जैसे कोविड आया तो उसके कारण eMedicoz इवॉल्व किया एंड उन्होंने वीडियोस डालना शुरू कर दिया था ऑनलाइन. तो उस चीज ने बहुत हेल्प करी. जो चीजें हमारी मिसिंग पॉइंट्स थे वो चीज बहुत हेल्प करी कि हम वो कंप्लीट कर सकते थे अपना. उसके बाद तो जो वीडियोस थी उससे हमने अपने हैंड रिटन नोट्स बनाए एंड दैट हेल्प्ड अ लॉट क्योंकि मुझे एक तगड़ी फोटोग्राफिक मेमोरी होती थी कि मैंने ये कॉपी में इस जगह पे ये चीज लिखी हुई है. तो मुझे वो चीज स्ट्राइक कर जाती थी, यार मैंने उस कोने में ये लिखा हुआ था. एंड वो चीज बहुत हेल्प करती है. मतलब जो लोग मेरे दोस्त पूछते हैं कि यार हैंड रिटन नोट्स लें या फिर वो लें, आई ऑलवेज एडवाइज देम कि भाई हैंड रिटन नोट्स वुड बी वेरी बेटर क्योंकि यू हैव अ ग्रेट फोटोग्राफिक मेमोरी ऑफ देम. So I found it that one thing advantage that live classes. So the DAMS that provide the advantage is live classes. The interaction the DAMS teachers do, no one else do that. They just make us feel कि हम पढ़ रहे हैं. हमें इंटरेस्टिंग कराते हैं वो सब्जेक्ट को फील. मतलब बिल्कुल भी बोर नहीं कराते. हम हमारे साथ कोई बैठा है, हमें कोई पढ़ा रहा है. So it's like one-to-one interaction which is going between the teachers and us. So it's a great feeling studying on DAMS. But like मतलब it's like I can't even express it कि it's that I sometimes think ना कि मुझे फिर से नहीं देखना. मुझे ऐसा लगता है यार ये तो सबसे इंटरेस्टिंग काम था तो ये नहीं करना पड़ेगा. So answers most importantly the CBTs, then TND course and the DAMS DVT. These helped a lot for my revision. Like CBT, so I scored last CBT 161 rank. And that was a great boost because that gives me the same environment कि मैं NEET का पेपर दे रहा हूँ. And that 161 rank out of 36,000 students, I was like, I have done it. I have to just मतलब उस पे और build करना है मुझे, ठीक है?
And eventually you got a rank of 200 amongst a lakh students. So it's like almost the same only.
So that CBT, that environment, that was amazing, that provided by DAMS. Matlab, CBT course was also amazing. The DBT, sir, I remember in last 10 days of my revision, I was just going through my DBT. It helped a lot. Many of the questions were direct from the DBT. मतलब I was saying to my friends, तूने DBT देखा था वो वाला, उससे direct question था, ठीक है? So it was so helpful. It was so helpful. And मतलब that was my last कि मैं last bite in teachers को देख रहा हूँ. So it was a great feeling. It was great nostalgia as well जब मैं DBT देख रहा था. So overall DAMS was like complete in मतलब एक place solution था हर चीज का, मतलब revision से लेके MCQ से लेके videos से लेके. So it was like complete in whole for me. मतलब मैं अपने juniors को हमेशा ये बोलता हूँ कि go for DAMS.
But thank you so much for the appreciation. But do you also strongly believe that ultimately, unless and until a student does the hard work of listening, making notes, asking doubts, getting it clarified there, adding it in the notes, listening to CBTs or GTs, and the revision, the videos that come along with that, unless and until a student does that hard work, then nothing comes free in this world. I always keep insisting on this thing ki ultimately you can be served everything on a plate, but ultimately you will only fill up your stomach if you put your hand and you start eating and chewing the food. So do you feel that unless and until one puts themselves out there and does this grueling task of listening to a lecture and writing their own notes and then go on and revising them, then this process becomes very, very easy?
Yes, so some of my batchmates, they can't go to the DAMS classes just because they were 4-hour lengthy classes.
Yeah.
They were like कि हम 4 घंटे लगातार नहीं बैठ सकते. And we were like, these 4 hours are the interesting part of our 24 hours. So we just stick to it no matter what, whether it's boring, boring तो होता ही नहीं था सर. अगर फिर भी कभी का ऐसा लगता था तो हम stick करते थे कि अभी नहीं समझ आ रहा लेकिन बाद में ये चीज समझ आएगी, क्योंकि सर थर्ड ईयर में थोड़ा फाइनल ईयर वाला समझ नहीं आता था. तो लेकिन हम स्टिक करते थे कि हम नोट्स बनाएंगे, उसको फिर से सुनेंगे, एंड वो चीजें फिर सेंस बनाती थी बाद में. तो चीज बहुत हेल्प करती थी कि अगर हम अपना कंसिस्टेंसी से पढ़ते रहेंगे ना तो पक्का चीज मिल जाएगी जो चाहिए. तो हार्ड वर्क और कंसिस्टेंसी is the most important
actually. If you keep on doing the same thing over and over and over again, then you automatically start becoming better at that. And that can only come when you give that much amount of time and effort to the endeavor, which I'm sure you must have given a lot, because I can see that satisfaction on your face. Ki, I have done it. So you know ki, itni mehnat lagti hai and I have done that because I know itna, that is very good. Okay. So that was very nice to hear. So now what plans, Abhinav? What are your future plans? What are you going to opt?
So I'm thinking, I'm just now a bit dicey. I just want to attend the NEETPG counseling session of DAMS so that I can get a bit clarified as well. So, and that would be my fan moment as well, seeing every teacher there who taught me. So most probably, sir, I'm thinking of radio diagnosis or medicine.
That is usually the catch between the two. With such good rank, you start inclining towards radio more than medicine. Yeah.
Yes, sir.
That is nice. That is nice. No, but both of them are wonderful branches, and you will have a very, very bright future ahead in them. And since you are somebody who has this immense lust for medical sciences, both these branches will offer you a lot of content to keep on reading and accumulating, because these are vast and they are constantly evolving, and both require a lot of reading. So I'm sure whichever you take, you will become very good in it, because you will keep on reading and building on it. That is something that you have this thing inherently. Though I'm very proud of you at this moment. I can say very few students I find who are so passionate about science. They go on and do wonderful things in life. Most of us, we tend to become very sidelined in terms of just an exam MCQ kind of a thing, but very few of you. And I can now see why you loved Diksha so much, because she was somebody who loved the science of pathology. So in her lectures, the most beautiful thing was that you could see the love of pathology there. She would just make the images talk. I used to often tell her. So I'll definitely pass on this message of yours to her.
Thank you so much, sir.
And at last, I would want to ask you if there is any snippets, any take-home message, anything that you thought that you could have done better or you regret, or any low points in your preparation, or any message for your juniors and friends who are going to prepare again.
So first of all, I'll say start early. It's very important. Matlab, I have seen many one around me only who started late, give their 100%, but still not able to reach there. It's just because I just get an extra edge just to start early. And secondly is the orientation towards the exam. When you start thinking you have to prepare for NEET, you have to be oriented कि questions कैसे आते हैं, कैसे पूछा जाता है, क्योंकि हम वो पूरे नोट्स पढ़ने लग जाते हैं, हम उसको उस तरीके से टारगेट ही नहीं करते कि क्या पूछा जाएगा इससे. तो वी शुड बी अवेयर ऑफ कि हमें क्या पढ़ना है, इससे क्या नहीं पढ़ना. तो जैसे एमसीक्यूज कौन से करने हैं, एमसीक्यूज क्या इंपॉर्टेंट बार बार ही पूछे जाते हैं, तो बहुत चीज इंपॉर्टेंट होती है. एंड आई स्टार्टेड इट वेरी लेट, knowing which MCQ to do, which not to do, and मतलब which topic to focus on. I didn't know it very early. अगर मुझे थोड़ा सा early पता होता तो शायद मैं और थोड़ा सा उसे better करता. And most important is the silly mistakes that just can be avoided by practicing only. I've realized that the more I practice, the more the mistakes will be less. So I just thought that कि अगर मैं और practice करता MCQs की तो उतनी कम गलतियां कर सकता शायद मैं इस बार भी पेपर में. तो nevertheless, तो तब भी ये है कि हो जाएगा पेपर. It's not that difficult. It's just the hard work and consistency that everyone has to give. So I know everyone can do this. It's just about the will they have to show for it.
Yeah, that is perfect thing. So if I would just summarize what you actually meant was that yes, definitely starting early is very, very important. But whenever you start, a very important aspect of preparation is to be aware of the exam, to know this exam demands what, when, how, and then only approach it, which is something that gets very easily done if you're following a protocol, a pattern. Usually the kind of things that we have generated around the content that we give in DAMS, which is starting from the notes, and then topping it up with the tests. And I always feel, I don't know what you felt, but I always felt that the GTs that we give and the CBTs that happen at the end, these are the best resources that a student has, because they give you a comprehensive assessment of everything and a very good exam feel. So those are the two things I always tell my students also to focus a lot. That if at all they have to spend a lot of time on MCQs, then it's always better to focus on GTs and CBTs.
Yes.
So that was very nice talking to you, Abhinav. You're very bright and a very happy guy. Something that I love to see in a young kid like you. My best wishes are with you, and do definitely let us know what you opt for, and stay in touch.
Yes, sir.
Okay.
Thank you so much.
All the very best. Bye.